Hi, this is Justin Vaughn with an article from MiraMed Global Services. Today's article is entitled, An Uncertain Fall, What Hospitals Should Expect. Let's begin. Now that fall has officially arrived, many in the healthcare industry are bracing for what could be a new wave of the coronavirus within our borders. Many of our students are back at school, and some fear this may trigger a new spike in COVID cases throughout the country. In addition, one doctor speaking on this subject in the major media this week indicated that the COVID transmission rate is expected to rise simply due to the cooler temperatures. Add to this the general controversy surrounding the nature of and treatment for this virus that we've witnessed since its inception, and you have the makings of a whole new season of speculation and confusion. The Centers for Disease Control, or CDC, didn't ease this potential for speculation and confusion when it recently put up new information on its website concerning the method by which the virus is spread, only to take it down within 48 hours. So what are decision makers at hospitals and health systems to do as they look to the concluding months of 2020? What steps should they be taking? Perhaps they must first get a better picture of what to expect. This section is entitled, Second Wave About to Roll. According to a September 5 article in the Washington Post, quote, infectious disease experts are warning of a potential cold weather surge of coronavirus cases, a long-feared second wave of infections and deaths, possibly at a catastrophic scale, end quote. The Post continued, quote, the warnings from researchers come at a moment when, despite a rise in cases in the upper Midwest, national numbers have been trending downward at a slow pace for several weeks following the early summer surges in the Sun Belt, end quote. Others agree there will be a second wave this fall, but may not envision the same catastrophic scale as reported by the Post. Appearing on local WBZ TV in Boston, epidemiologist Dr. Shira Doran at Tufts Medical Center stated that some increase in COVID cases is inevitable due to the cooler fall temperatures. However, she went on to speculate that the rise in cases may not be as severe as what we saw this past spring. Quote, it's very unlikely that we would see a surge in the sense that we did back in March, April, where the rate of rise was so dramatic, end quote, she said. This section is entitled, A Double Whammy. That's all well and good, assuming Dr. Doran's speculation turns out to be correct, but what about dealing with a potentially moderate jump in COVID cases, in addition to dealing with the full-on effects of the traditional flu season, expected to begin in October in the U.S.? This potential for a twin-demic, as some are calling it, may put new strains on hospital staffs not seen in some time. According to an article posted last week on Science News website, influenza hospitalizations in the U.S. since 2010 have ranged between 140,000 and 810,000 individuals. Adding these numbers to expected coronavirus cases this fall may present the perfect storm for those tasked with hospital resource management. Nevertheless, some appear ready for the storm. According to a spokesman for Tufts Medical Center, which is currently running at 80% occupancy, the facility will be able to handle the combination of COVID and common flu patients expected to come their way in the next few weeks. Others are optimistic that the perfect storm will break apart before it reaches our shores. Science News points out that influenza forecasters in the Northern Hemisphere base much of their prognostications on the levels of flu occurring in the middle of the year in the Southern Hemisphere. If those living below the equator have a relatively mild flu season mid-year, then that's usually an indication the U.S. will have smaller numbers of flu patients during our fall and winter. Reportedly, the Southern Hemisphere has had a mild flu season this year, which augurs well for hospitals in the U.S. In addition, the flu season may also be milder than usual in the Northern Hemisphere as a result of reduced travel, according to former CDC Director Tom Frieden. Others point out that the already ubiquitous use of masks and social distancing due to COVID should help to suppress normal flu transmissions. This section is entitled Preparation and Optimism. As reported by WBZ-TV in Boston, Tufts Medical Center is already in the planning stages for the impact of a second wave of COVID. This includes stockpiling personal protective equipment, or PPE, and, quote, bolstering testing, end quote. What's fascinating about Tufts' approach is that, quote, this time they hope to treat novel coronavirus patients without canceling elective procedures for other patients, end quote. It is uncertain how many hospitals will be following this same model. In another indication of where hospitals stand as far as preparations for this fall, the September 18 edition of the Wall Street Journal noted that, quote, U.S. hospitals expect to be better prepared if a second wave of COVID-19 cases hits in coming months, doctors and administrators say, after gaining a better understanding of how to triage patients, which drugs to use, and what supplies are needed, end quote. In summation, many remain hopeful that while there may be a spike in COVID cases this fall due to school resumption and cooler temperatures, A, hospitals will be in a better position to handle such cases, B, the flu season may prove less of a problem this year, and C, there may be hope for those seeking elective surgery to receive the care they need. If we can assist you in your preparation for fall cases, please reach out to us at info@miramedgs.com. We want to be your partner in finding solutions that work. Thank you.